Hello, my name is Luigi Biel, student in Dr. Patricia Potiet's class for Health Informatics, and today I'm here to discuss my data-based analysis of sexually transmitted disease prevalence within the adolescent community, and potentially provide the viewer with ways to become more aware of the growing issue. In summary, adolescents and young adults are one of the most affected populations with respect to STD prevalence rates in the United States. As STDs are reportable to the CDC, there is plenty of data that is available for analysis to determine behavioral risk factors which can be addressed to make the population more health-oriented and mindful. Health promotion in schools and other youth-serving organizations can help young people adopt lifelong attitudes and behaviors that can support their health and reduce prevalence rates within the population. The target population for this analysis would be adolescent youth and young adults ages 15 to 24 years of age that are enrolled in public schools and visit community health centers for reproductive health needs. The goal of this analysis is to raise awareness among community stakeholders to drive the importance of timely preventive health screenings and safe sexual practices among the target population. 4 different types of stakeholders were identified in the analysis. They include implementers, which consists of healthcare providers, health educators, and local school district health departments. Decision makers, which include the local State Department of Health and Human Services, Department of Education Health Services Division, as well as the Community Health Department program directors. Participants, which would be the target population along with any other person that fits the criteria, and partners, such as taxpayers, parents, coalition partners, and the media. The image presented is an influence diagram. The decision makers would be the ones who are in a position to make or create the policies for the STD program interventions, whereas the implementers are those involved with the STD health intervention program. Participants would be served, as well as influenced, by the program partners and implementers of the health intervention. To better understand the problem, one must understand the determinant of health factors in which the target population face. From a policy perspective, there are states in the U.S. which prohibit adolescents to receive reproductive health care services without parental consent. This can act as a deterrent for youth to get the health care needed. The community level is also facing issues with providing care to the lesbian, gay, and bisexual young adult community due to a lack of culturally sensitive health services for adolescents and young adults who identify within this group. From an organizational status, state or local organizations can implement initiatives to raise awareness for sexual health hazards to prevent reckless behavior. On a family level, interpersonal relationships can be hard to determine for target population, and communication between family may not exist in relation to sexual health. Individuals within the target population face a lack of knowledge and fear stigmas from their peers. An infographic was created to be distributed among schools and community health centers for the target population. Introductory information was obtained through the CDC website, as the primary goal for this infographic is to draw the viewer's attention by easing them into the intervention. Basic STD facts such as transmission methods as well as gender susceptibilities were mixed in with statistical data sets that were obtained from the Youth Risk Behavior Survey and reporting tools from the CDC website. Additional information can be relayed during health intervention sessions by stakeholders in the implementer role. Such education may include signs and symptoms of every STD along with treatment options for members of the population who have an STD. Data from the Youth Risk Behavior Surveillance System was then utilized to inform the person reading the infographic of the percentage of adolescents in grades 9 through 12 who engage in sexual intercourse. Metrics for incidence and prevalence rates were used to cause a shock factor in the person viewing the infographic. By indicating that half of all new cases fall within the 15 to 24 year age group, and that 1 in every 4 adolescents has an STD, it should elicit concern within the participant and have them reconsider risky health behaviors. Decision makers should reconsider existing health policies to allow for rate reductions in both incidence and prevalence rate. Additional data relating to gonorrhea and chlamydia was chosen as they are the most prevalent reported STD among the target population. However, as the CDC fact sheet points out, other STDs are on the rise in prevalence. Partners and implementers can create opportunities to contribute in influencing participants to reduce prevalence through social marketing campaigns to raise awareness and promote positive health behaviors. The last part of the infographic includes a preventive component to reproductive health services. While there are several ways to promote prevention, the easiest one is to wear condoms with every partner, get routinely tested with STDs, and limit the number of sexual partners participants have. Decision makers, implementers, and partners alike should all come together to promote an increase in health literacy and reproductive health awareness. In conclusion, all identified stakeholders can contribute to reductions of STD prevalence in young adults. The age group range of 15 to 24 years account for nearly half of all new STD cases each year, and it shouldn't be that case. Effective sexual health programs are required in all local communities to strengthen core prevention infrastructures which address objective goals in increasing health literacy amongst young adults while reducing prevalence rates within the specified group. This may mean enhancement to current policies and procedures or additional training of healthcare professionals to be able to accurately capture the target population. Thank you for your time.